Hi, it's Dr. Derek. Today I would like to talk to you about a condition called costochondritis. It's not a condition you hear of often, but when you do have it, you'll know it. It's a very painful condition. Costochondritis is an inflammation of the costal cartilage that attaches here onto the sternum. So let me show you a picture of it here. So here's your ribs, and here's your costal cartilage, and it attaches onto the sternum, and where this attaches, this will get inflamed and it will be painful. So costochondritis is typically occurs in women over age 40. It occurs typically on the left side of the body, and it occurs typically between the third, fourth, and fifth rib. If it's a little bit higher and is swollen at that point, that's typically a condition called tsetse syndrome, which is different from costochondritis, but that's another story. So what do you do if you have costochondritis? Well, you know, in these videos that I've been making, I've been talking about using the tennis ball. And you would think that in this case you would lay on the area right over here or along the back, along the same level of the ribs. You do not want to do that. I would not recommend using the tennis ball in that area in this type of condition. It would probably inflame it and make it worse. But what you can do is, if you have a tennis ball, you can go in the areas above and below where that level of pain is, to try to loosen up those muscles above and below in the back. But what I would recommend for costochondritis, one of the best things you can do is get to your chiropractor. Why? Because typically these vertebrae in the back, if they are misaligned and subluxated, this can be a cause of the costochondritis. Why? Because the ribs here, here's another picture. Here's the vertebra. If this misaligns, it can cause the rib to misalign. And if the rib misaligns at the rib head here where it connects, it can cause a misalignment and inflammation here along the sternum. So one of the best things you do is go to a chiropractor who has experience treating costochondritis, because it's you want to be very specific on which bone you adjust and how you adjust it. You want to be very gentle. In fact, typically when people come in with costochondritis that's really hot, I do a whole different approach for adjusting that vertebra, because again, that could make it worse if you just start to adjust in that area, because it's already inflamed. Any type of pressure is going to be very painful. The best form of treatment for costochondritis that I found in my experience is using the warm laser. So we have a class 4 warm laser, and the warm laser is awesome for treating costochondritis. The person, you get on the skin and you go along the costal cartilage there, and there's a little, between the ribs, you have these little muscles called intercostal muscles. They get very tight, and the inflammation, the laser is very gentle. It feels like a jacuzzi on that area, and you do it along the site of pain, and it typically knocks it out in a heartbeat. The laser is great for costochondritis because there's no manual pressure, and it's very, very comfortable. And it's very, very effective. If you want to know what you can do to prevent costochondritis, the first thing I say is you should be under the regular care of your chiropractor. However, sometimes you could be doing some heavy lifting, or you can be under a lot of stress, or something. You can even have an infection in this area that can throw that off. So if it does happen, it's painful, and there's an exercise that you can do to try to prevent you from having costochondritis in the first place. It's just a great exercise that you can do to open up your chest cavity and loosen up the tension here in these muscles in the chest, and I'm going to give it to you right now. So what you do, you can do this standing. Your hands are going to be like this, your palms facing outward, and you're going to come up, take a deep breath in, and breathe out, and back like this again. And so you're going to breathe in and out, and that just kind of opens up the whole chest wall. Now, if you have a shoulder problem, that you may not be able to do that exercise, or it may be a little uncomfortable to do that. So one thing you can do to take a little pressure off the shoulder, that is an issue, you can do the same exercise laying down. So you can lay on a bench or on your bed. You're going to be up like this, and you're going to be doing it just like this. Breathe in and out. And it's very relaxing. It opens up the whole chest cavity. It helps keep things in balance. And it's like you're swimming, kind of doing the back float in the back here. And it just feels very good and relaxing. So I hope this video has been helpful. Once again, if you have costochondritis, I would get into your experienced chiropractor to get taken care of. we have excellent success with treating this condition so you don't have to suffer, because typically it's a self-resolving condition. It typically goes away in a couple of weeks, but sometimes it can last up to a year. I've seen cases where people have had it for over 6 months, and why suffer needlessly when you can get it easily taken care of through your chiropractor? So hope this video has been helpful, and this is Dr. Derek signing off.
Hello, my name is Kathy, and a few days ago on the weekend I came down with an attack of what is called costochondritis. It is extremely painful and essentially hits the rib area on this side and also all the way around the rib cage. Extremely painful. I came to see Dr. Taylor, explained the situation, and he said he could take care of it. This was on Monday. It is now Thursday. I've had 2 treatments with him in his office, and I feel great. The pain is gone, and I'm going to walk out of this office feeling wonderful. And the only thing I have to say is, you're a miracle worker, Dr. Taylor. I love you.